What's up, motherfuckers? It's Kiwasabi. Hey! Forgive my foul mouth Friday. This is a filthy fucking episode, I'll tell you that right now. Happy Friday, everyone. This is another episode of Lotek Talks. Let ourselves translate expert knowledge with your host and only guest so far, Brad Burns. So, last night, there was fucking fuckery afoot. Quite a bit. It seems to be the word of the night. It's going to be especially foul. Filthy motherfuckers, I swear. When you condition somebody to feel like they're doing the right thing when they're acting out like a dumbass, you get more dumb assery. Now, I'm going to act like my parents aren't watching this, and they're not the only people who listen to this and watch. So, that's right, I'm eating. I'm fucking eating. I'm pissed. I'm gonna eat an entire pig. This is such a foul Friday. I guess the hospital closes on Saturdays and Sundays, so they gotta get all this shit in. Anyway, it didn't even start with the hospital and the industry itself, but the patient's family. This dude's got bad cancer in his mouth, for sure. He's not doing well. And he may or may not be entirely confused. He's agitated. I know my agitated patients. They need to be spoken to directly. They don't need to be asked 1,000 questions. They need to be told, this is how we're going to communicate. I'm going to assess your needs. I'm going to help you in these certain ways. But what we're not going to do is throw our legs out of bed, jump out of bed, get a head injury, anything that could happen. And this girlfriend, which is fucking with my head at this point, because he's kind of old. He's 50s, 60s, something like that. And she's telling me he doesn't know what's going on. He can't be spoken to in this tone. She turned all Christopher Walken on me, like, hey, you're talking to my guy in the wrong tone. You see, you do it again, I'm going to stab you in the face with a soldering iron. It's not very good Christopher Walken, but she wasn't doing a good Christopher Walken either. So she tells me he doesn't understand. Then walking out of the room, she's trying to negotiate with him and explain in many different confusing ways, which I can smell compassion fatigue on her. I can smell that she hasn't slept. I can smell that she definitely hasn't bathed in several days. She's going out, coming in, smoking cigarettes, freaking herself out. And then at one point she tells me, this is exactly what happened with his brother. And I'm trying to pick up pieces. Because she is this dude's girlfriend, the patient, and she's telling me the same thing happened with his brother, whom she was also in a relationship with. So I'm thinking she's got the taste for blood, and she killed this brother. She told me that. She said, I killed him. No, she didn't in those words, but she said, when I asked, well, what happened? And she said, he died. And I said, okay, well, we're going to do something different this time, and it's not going to be exactly that way. We're going to keep him safe. And she wasn't having it. She said, I don't like your tone. What's your tone? Your tone. It was like a 5-year-old who starts hearing that they've been bad and yeah, dad voice comes out and they just don't want to hear it. They shake their head and scream. And I get it. She's going through a lot. I wish I prefaced all this with, I really care about these patients. I love them. I need them to know that right away, that I will treating them exactly as I would hope someone would treat my family member. I'm not abusive. I'm not trying to hurt him or strap him down or make fun of him. I'm gonna be direct. This is important to know what's happening. And yes, he knows more than what he can let on. His tongue is swollen up. He's got cancer so much in the back of his throat that he's not able to clear his airway. And the fucking industry is making me question, because he's got a dysphagia 1 diet, and he's being fed with a tube feed going. And I don't know what's happening. I don't get it. I don't know what's happening. People jump into conclusions, especially his girlfriend, who's got a taste for blood, killed his brother, and is moving on to this guy, and she fires me. We switch in the middle of the night, which is a dangerous thing. Handoffs are one of the more dangerous parts of hospital care. That's why we have timeouts. That's why we stop and say, hey, is this the right leg? Is this the right patient? Is this the right time? Which we'll get to in a few seconds. We switch, no big deal. I don't really care. I'm just a turd in the pool trying to keep the the staffing appropriate. Just so I'm here because there is a problem. I exist in this hospital because there's a problem with retention. And I know that. And it comes from this kind of weakening, this spineless morale destruction of conditioning patients to act poorly. And it's not just the patients, especially it's a family who think that they can run things, pick and choose products of what they'd like to buy. And in a way they can, but when we're moving in this right direction, like the day shift had told me that he refused a medication, insulin. This guy's blood sugars hasn't been down below 200, 2 to 300, which is not helping him heal. Could possibly have ended up being a stroke symptoms. Could be definitely masking his symptoms of not being quite there. But he's on a no AMA hold, which means he is incompetent to make medical decisions for himself. And he's refused an insulin. Whatever. Move on to this morning, in which I get a call about a patient who's supposed to be coming to another floor to get a central line. I had no idea they're getting a central line. I didn't think this was actually happening. And then the charge, the same one who makes this decision that we should switch patients in the middle of the night because who cares about continuity of care, even within a shift, says I need to give a report. Doesn't question. She looks through the chart. She can read just as well as I do. Nothing in this chart says this patient's getting a central line. They don't need it. I tell her that. I don't believe this. And she makes me give report to a nurse, I guess, someone who doesn't. She may have been stealing information. I don't know. Who knows what was going on. But to state her name, get her to explain it to me. Transport comes, and I've already paged the doc and said, hey, I don't think this is supposed to be happening. I don't understand what this is. They haven't mentioned it to me. Have they talked to you? Doc calls me and says, I don't see this anywhere in the chart. Wow. And this is 6:45 a.m. All this is happening. Transport's coming. It's fucking snowing. And I don't know what's going on. I'm pissed a little bit. And my bacon's done. So forget my fucking foul mouth Friday, but I'm gonna have some fucking bacon. Thank you for listening. I hope you have a great weekend. I love you all. Thank you for listening. This has been an especially foul. Forget my foul mouth Friday. Let ourselves translate expert knowledge. Thank you.